You're listening to Addiction Medicine Beyond the Abstract, the official podcast of the Journal of Addiction Medicine. If this is your first time listening, thanks for coming. Addiction Medicine Beyond the Abstract is produced for your enjoyment and is focused on the latest journal-published research and science in the field of addiction medicine. Remember to add us to your favorites in iTunes, and you can also follow us on Twitter at ASAM.org and Facebook. Now, let's go beyond the abstract. Welcome back to another episode of Beyond the Abstract. Thank you for joining us once again. Today, we are sitting down with Dr. Blythe Bynum to discuss her recent article in the November-December issue of the Journal of Addiction Medicine titled Navigating Choices, Pregnancy Options Counseling Experiences in Individuals with Opioid Use Disorder. Dr. Bynum talks about what exactly pregnancy options counseling is and why it matters for individuals with substance use disorders. She also shares insight into how addiction medicine providers can incorporate basic pregnancy options counseling into addiction treatment and addressing specific concerns like pain management and MLUD. A little bit about Dr. Bynum. She's an assistant professor in the Department of Obstetrics and Gynecology at Thomas Jefferson University in Philadelphia, Pennsylvania, and she is a board-certified OBGYN with fellowship training in complex family planning. All right, now let's get into today's talk with Dr. Blythe Bynum. But yeah, so first of all, Dr. Bynum, thank you so much for taking the time to sit down and talk with us today. Really excited to speak with you. I want to kind of let you take it away, but I want to start at the beginning as we usually do with our interviews here. And I want to hear a little bit about why this particular field. What was it about addiction medicine that interested you and led you into a career in this particular path?
Yeah, well, thank you for having me. So I will say I am an OBGYN by training. So I haven't done any addiction medicine training, but it is a strong interest of mine. And what that kind of came from is when I was in residency, we had a doctor, and her name was Caitlin Martin. She came during the middle of my residency and opened up a OB and substance use disorder integrated program. And throughout my 4 years of training, I just really saw the changes that she was able to make in the way that we took care of patients. And this was from like how they were treated during check-in to how their labor and delivery process went, their interactions with pediatrics after their deliveries. And so for me, that made a really big impact. And I wanted to continue to take care of these patients and be able to help these patients in my own way as a OBGYN.
Yeah, it's amazing. Well, speaking of that path, the OBGYN path, we're going to be talking today about something called pregnancy options counseling. So can you kind of lead us into what is this? What is pregnancy options counseling, and why do you feel it's important for individuals with substance use disorders?
Yeah. So pregnancy options counseling is basically discussing abortion, adoption, and parenting. Just basically naming those three things after somebody has a positive pregnancy test. So for me, if somebody comes to my office and their pregnancy test comes back positive, I obviously want to listen and validate their experience upon hearing this news, because about half of pregnancies are unintended, and what everybody wants after this diagnosis is different. And so once I start the conversation with the patient, I will say something like, we can discuss any of the options that you're interested in hearing, including continuing the pregnancy, not continuing the pregnancy, and if you do continue the pregnancy, discussing either parenting or adoption. And just kind of saying those things out loud just takes away the stigma and allows people to kind of settle into their thoughts and decision making.
Awesome. And in particular, when it comes to patients who are dealing with substance use disorders, when you have that kind of intersection, why do you think that this kind of pregnancy options counseling becomes important for them as well? Are there specific things that they're going to deal with that might change their sort of path or their route?
Yeah, so we definitely know that having like substance use disorder, opioid use disorder impacts how pregnancy looks. So I think, particularly for these patients, there's this tenet in family planning that's called reproductive justice. And what that is just kind of supporting all people in the right to parent, to not parent, and if they do parent, to do it in like a safe and healthy environment. So, thinking about that for these patients, and just kind of letting them know what their pregnancy could look like. So, if somebody with opioid use disorder comes to me as somebody who's a family planning provider, who provides abortion, my counseling changes a little bit about kind of pain expectations, where patients might have a procedure done, um, talking about their different anesthesia options. And then, as someone working in the hospital, obviously the physiology of pregnancy is a wild thing. And so, somebody who's been on a stable dose of like methadone for years, that can change drastically in pregnancy. And so, just having people know that up front, or know that where they're going to deliver, there are like mandatory reporting policies in the hospital, preparing them for their child being monitored for NAS. So I think that counseling ahead of time as much as possible, because these patients are put against a lot of barriers and a lot of challenges in our healthcare system, and just kind of knowing that for me in giving these pregnancy options is really important.
Yeah. I wondered too, what are some of the unique considerations in pregnancy options counseling that help to like build trust and communication between patients and the healthcare professionals that are working with them?
Yeah, that's a great question. So in my research study, we looked at patients particularly on medication for opioid use disorder. And that was just because we knew these patients had like interaction pretty routinely with an addiction medicine provider. Um, and in talking to these participants about how this news was disclosed, I think that there were a lot of opportunities to build trust. So some of the participants didn't even know they were being tested for pregnancy. So, first of all, just telling people about tests, getting their consent, and telling them the reason for the test was a big thing. And then the delivery of the news. So, again, obviously, the addiction medicine clinic isn't like a OBGYN clinic where the main focus is to talk about pregnancy. But if somebody's test does come back positive, sitting them down in like a private space where they can absorb the news and have somebody to discuss that positive pregnancy test with is huge. I think in obviously maintaining that trust as an addiction medicine provider, but then just having the patient know that you're supportive of them in their choice moving forward.
Yeah. I wonder too, speaking specifically to the addiction medicine providers now, how do you think that those addiction medicine providers could incorporate basic pregnancy options counseling into addiction treatment?
So I will say that is a hard thing, because as I'm sure that you're aware, the state of reproductive healthcare in this country has been in flux over the last 5 years. And so the counseling and resources that we as physicians can give varies kind of state to state. So really knowing that the three options exist: abortion, adoption, and pregnancy or parenting, and giving that information a timely manner. So not delaying the disclosure of the results is one of the most important things I think that addiction medicine providers can do.
I want to ask too, as you did kind of touch on it and you reminded me, I wonder if you think pregnancy options counseling can actually address specific concerns like MOUD and pain management. I know you mentioned sometimes you'll have someone come in, they're on methadone. That's something that you have to sort of consider when you're speaking to them and coming up with a plan. How do you think that those things kind of integrate with each other?
Yeah, so I think pregnancy at one point or another, unfortunately, will be painful. And so whether somebody has an abortion or goes to on to delivery, I think that working together as a healthcare team. I really do believe that like no physician is an island. And so when it comes to taking care of these patients, if they are going to be on labor and delivery and laboring and have an epidural, working with the anesthesiologist. If they have a C-section, coming up with a post-op plan on how to optimize their pain control, and making sure they're set up for success when they leave the hospital after what is a pretty major surgery. So I think that really collaborating across teams is one of the most important things for these patients.
I wonder too, looking forward, what kind of research questions kind of came from this qualitative study, and what kind of research studies do you think might be able to address those questions that arose?
Yeah. So I think that obviously I was listening to those who have opioid use disorder, but I know every story has two sides. And so I think it would be interesting to know about addiction medicine providers' comfort with discussing pregnancy test results, if they have knowledge about pregnancy options counseling. I think that those would be really important moving forward in order to better take care of these patients. And then another question that came up, obviously, if these patients are being tested for pregnancy, are they being talked to about options for preventing pregnancy? So I think also further understanding these patients' kind of unique desires when it comes to contraception counseling.
I want to kind of wrap up. We like to ask for advice from our guests, and I really want to hear some of your knowledge and wisdom. You're at this interesting intersection here. You said you're an OBGYN, and there's this crossover with addiction medicine, but what advice do you think that you would offer to upcoming generations of not only the addiction medicine professionals, but OBGYN professionals that might, find that they come across this in their practice or find that they're dealing with patients that are living with substance use disorder? What kind of wisdom, what kind of advice would you offer to them?
Yeah, I would just say, as somebody who is not addiction medicine trained, it's important to be curious. So when these patients come in, oftentimes, unfortunately, there's a lot of stigma, or people will say, well, we have to do this for them. And I think just kind of asking why, because I guess for an example, a lot of times, like, these patients' medications get changed. Some people think their medications should stop if they have a surgery and they're going to be on opioids. Like, just making sure that you're asking questions so that you're setting these patients up for success, is the most important thing that somebody who doesn't have this specialty knowledge can do, and relying on our addiction medicine colleagues to care for these patients.
Dr. Bynum, thank you so much. It's been great talking to you today.
Thank you. I appreciate it.
This ends today's podcast. Thank you for listening to Addiction Medicine Beyond the Abstract. All of today's show links can be found in the show notes. Remember, you can preview additional abstracts at journalofaddictionmedicine.com. This program was produced by the American Society of Addiction Medicine.